So you're thinking about building your own virtual practice. Because of more freedom, you can work from home or you can travel and work from wherever you are in the world. You might have thought about opening your own virtual practice because that allows you to own your own schedule and that allows you to do things your own way. There are many reasons why people choose to have a virtual practice. It is also one of the easiest way to get started without having to spend money on a receptionist or a big office space, right? And you can work from pretty much anywhere. So in this video, we're going to talk about how to put together a virtual practice and the 6 things that you want to have in place to be successful. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and we teach providers how to build successful practices and how to implement the clinical application of functional, nutritional, and herbal medicine so they can be successful. When we talk about practice building, we want to make sure that we have a few things in place. And the way that I look at it is almost like a funnel. We have multiple people in your community or beyond that might be struggling with different conditions, right? This little person here, they struggle with diabetes, right? They've been taking their medication, metformin, which unfortunately 1 out of 3 of those patients suffer from digestion symptoms as a part of the side effects of medication. And this person does not want to take medication, right? They want the more natural approach to diabetes. Maybe this person struggles with joint pain and they tried everything out there. Maybe they've tried cortisol injections and they tried different pain medication and they're just struggling, right? So what we want to have in place is we want to have a funnel that allows us to get these people in and all the way to get to you so you can help them and guide them towards better health and better function. How does that work? Well, essentially, the first thing you want to have is you want to have a place in which you can get the attention of those clients about you and your services, right? So, for example, if I choose to work with patients that have chronic pain, then that will be my message, right? That will be chronic pain. I have natural solutions for chronic pain. Or if you're doing functional medicine, you have a way to understand the root cause of their chronic pain, right? So there's 2 different ways of doing it. The old-fashioned way, which requires 0 investment of money, is to go out there and do seminars or networking or different events. And I cover a lot of that in my other video, the 6 simple steps to starting your own practice. And you can watch that to get a better idea of that. But there's another way to do that if you want to be completely virtual and you want to practice from anywhere and be able to travel. And that's going into the marketplace where all these leads are found. All these people are spending their time, right? And virtually, that could be in places such as Facebook, right? So most adults have a Facebook account in which they scroll through. There's also YouTube ads and there's also Google. If we want to target chronic pain, then all we got to do is put an ad for joint pain, right? And then these individuals, so we go to Facebook, we put the ad on, right? We put a picture, we upload a picture, we put some text. These people that have joint pain, when they see your ad, they will typically click on it and ask for more information, right? They would want to learn about your natural approach or your functional medicine approach to addressing joint pain because that's what they're looking for. Guess how many people with chronic conditions and how many Americans are looking for natural solutions to improve their health? It's about statistically 7 out of 10 adults in the United States that are buying supplements, that are reading about supplements, that are driving to the store, the natural food store, to buy supplements. It's a big industry because there's a big need for that natural solution. So we're putting ads, we can put ads on Facebook, ads that as they scroll through the pictures of their friends or grandchildren, right, they see your ad, they click, I want to get more information about you and your services. And that takes them to a page, a simple page. We call this a landing page, right? And on this landing page, we call it a landing page because that's where you're landing, right? So when you click from Facebook, it takes you straight into this landing page. And in this landing page, ask them for their name. You can ask for their email. You can even ask for their phone number. And most importantly, what you want to have in that page is you want to have some information about yourself. So that could be, for example, a little video that you can upload to YouTube about yourself, who you are, why you're doing what you're doing, your story, right? Why do you care about them? And then invite them, maybe share a success story, how you helped yourself to improve your health, or a patient or a friend, right? And then you finish with an invite to get a consultation, right? And that's where they also have information about how to schedule a call with you. So we got one. The first thing we want to do is have a Facebook or some sort of ad somewhere, right? When I first started years ago, social media was not really available. People really didn't use Facebook or YouTube or Google much. And so I would go out and talk to people. You have hobbies that you go to, you talk to people about what it is that you're doing. But today, if you do it in 100% virtual, you can go to the marketplace where everybody is, Facebook, YouTube, Google, and you can put an ad there. And that ad, people click on it to get more information. That's step number 2. Step number 3 is the landing page, which is a simple one page that they can get more information. And then the third one is basically where they schedule a call, right? So it's pretty straightforward so far. And that's where during the call, that's where they connect with you, right? They schedule the right time. You can offer them a free 10-15 minutes consultation. During the consultation, you really want to focus on 3 things. The first one is where they are right now, meaning what is their pain point? What are they trying to resolve? The second thing is what are the 2 most important goals for them, right? That could be going to sleep and waking up with less pain, or being able to play with the grandchildren, right? So what is it that matters to them the most? And then the third thing is figuring out if they're a good fit for you and you're a good fit for them. So we want to keep our integrity and make sure that we understand them a little bit and they connect with us before we make a decision if we want to commit to continuing to working together. So that's essentially the last step in this, which is your consultation. And if everything looks good, you follow the steps that we show you in the consultation, then we proceed from there to working together. So that's where we connect, we work together, they come to see us maybe every week or every other week to get feedback deeper into resolving their root causes and guiding them to improve their health. Now you might be asking yourself, Tal, well, how do I put all of this together? Well, we have specific trainings that can show you that, but I'm going to show you the tools that can help you to automate all of this. You build it once, and then you just let it work for you 24/7. And that's the beauty of putting together a virtual system. When you have something like this working for you, it works all year long. 365 days, it works for you, right? People go to YouTube in the middle of the night or early morning. That's still working for you, right? They still ask for more information, get to the landing page, see your video or your information, schedule a call, and then you just show up whenever you are available. There's a lot of freedom in that, and it's very comfortable to work in that way. Now, what are the types of tools that you might need when you're putting this together? Of course, you need a business identity and everything else that comes around it, but I have a separate video for that. That's 6 steps to building your own practice. But here we're going to talk mostly specifically about virtual. So the first thing that you'll need is a YouTube account, right? That's free. That's a place for you to store your video about yourself. Now, if you don't want to do a video, you just want to do text, you can do that. You can have a landing page with a text. The second thing is you want to have a landing page. Landing page is pretty straightforward. There are different softwares out there that offers you the ability to have a landing page. Some of them are really affordable. The third thing is you want to have a Facebook account, which most of us already have a Facebook account. There is a way to also get clients without using ads, which is to simply post. And we have different examples in our training on what to post. For example, if you're focusing on chronic pain, you can post about the 3 top supplements for treating chronic pain, right? One of them could be curcumin, one of them could be boswellia, one of them could be omega-3s, right? So the 3 supplements that can help patients to reduce inflammation and reduce pain. And then on the bottom of the article, you add, if you're interested in working with me to help you achieve better health, reducing inflammation, and feeling better, here's the link to schedule with me, right? So you can do that, and we have done that multiple times. Essentially, once you have a Facebook account, you can establish your Facebook business account, which is, again, it's free, and that gives you access to doing Facebook ads. And there's multiple tutorials on how to do Facebook ads. We have our own specific where we actually we'll actually show you ads that are working and you can mimic them, but it's pretty straightforward. You can reach as many people as you want. And all you're doing is, with Facebook ads, you're putting a certain amount of money into it, and Facebook gives you a certain number of people that are interested in your video, right? So if you want to show this ad to 1,000 people, you pay a certain amount of money, right? And typically, if you're doing it right, for every $100 that you put in, you'll get about 20 people that are interested in your offering. Now, the next thing you want to have is you want to have a place you can do the scheduling, you can put notes for patients, and that could be an EMR, that's electronic medical record keeping software. And there are some really good softwares out there that already have scheduling, has scheduler, it has a billing ability, has telehealth, it has everything, right? So there's multiple, and there are some from $25 all the way to like $60, right? So it's pretty affordable. Now you also have Zoom, if you just want to do Zoom. Then Zoom, the $20 is their HIPAA compliant telehealth. So you got your YouTube, that's where you're gonna put your video on. You got your landing page, you got the Facebook ads, and you got the EMR. One of the things that I would recommend is to get guidance and strategies on how to grow this virtual practice, establish it properly, and then grow it to increase your income. Because one of the things that we've seen is, and I experience it myself, is you learn functional nutritional medicine and you go out there and you're trying different things. Like myself, you read different things in certain books, so you went to you watched a certain video seminar about building a practice, and being out there by yourself, trying to build a practice is very challenging. And in the first 7 years, I know for sure I made so many critical mistakes that cost me time, cost me money. So we want to make sure that you avoid making those mistakes. It took me several years to understand that the value of a system and mentorship, have somebody that have been there where you want to get to, and they can guide you in a straight line to get to where you want to go. So that's where we focus in our practice building program. We focus on the guidance, we focus on the strategies, we focus on where you are right now and focusing on where you want to get to, right? What are your goals? This could be personal goals, this could be financial goals. We help you get to where you need to get, and we also give you specific information into how to do the D's, right? Just to summarize it, the overall experience is that they go through this funnel in which you collect their name and information. It goes into here. They go into a simple web page that have a little bit of information about you, contact information, maybe a video could be great because they can really get a feel of who you are. And a video, by the way, you can do a video with your phone. So if you got a phone, you can record a video, upload it to YouTube, create a YouTube account, it's free, upload it to YouTube, and now you have a video about yourself, right? Doesn't have to be fancy, it just have to be you, right? That's what they're looking for. So here's the process. If you have any questions, reach out to us. We'll be happy to help. This is what we're passionate about, helping people like yourself to build the dream life, build the dream practice, enjoy more freedom, enjoy better income, and enjoy helping their community. So I'm Tal from the American Academy of Functional Health. I thank you for watching this, and take care for now.